Thank you for joining us on Journey to 600. Today we're going to be focusing on the neuromuscular system and more specifically expanding on strokes based on brain lobe. This is going to be a lengthier video, so I might split it up into 2 or 3 parts. So first we're going to be focusing on the frontal lobe, which deals with judgment, language, function, motor planning, and problem solving. So just to refresh on what the frontal lobe does, like expanding on it. So when it comes to speech and language, um, the left side of the brain, specifically Broca's area, helps with forming thoughts into verbal language, but also other parts of the frontal lobe help with language skills. And other parts of the brain help with language. I mean, it's in the frontal, temporal, and parietal lobes. And also, I think it's important to note that language function is primarily located in the dominant side of the brain, which is usually the opposite of your dominant hand. So, since most people are right handed, you'll find language function is housed in most left sides of the brain. Motor skills. So, the frontal lobe is home to the primary motor cortex, a region that controls like muscle movement and initiation. This allows you to do most of the physical movements that you could think of. Executive function. So the frontal lobe plays a critical role in a person's ability to plan, make decisions, multitask, and manage their needs. It also plays a big role in attention and concentration. Empathy and social skills. So, frontal lobe helps us empathize and understand the feelings of others. It also is responsible for impulse control and emotional regulation. So, from the last video, you'll remember that like some patients who have frontal lobe strokes, they could possibly be impulsive or more cautious and things like that. That'll kind of lead me into like how behavior and personality could change because of that too. Like you might struggle with motivation and having random outbursts, being rude or irritable, careless, apathetic. I mean, you could have like incontinence of bowel and bladder because it's not socially accepted, so your behavior is going to be a little different. So, after refreshing on kind of what the frontal lobe does and expanding on it, um, when you have a patient who has a right frontal lobe stroke, you're going to see left sided weakness. It's the opposite. Um, you're going to see various language skill deficits, motor deficits, executive function deficits, and empathy and social skill issues. Whereas on the left side, if you have a left frontal stroke, you're going to see that Broca's area being affected. So you're going to have expressive aphasia and apraxia, right sided weakness, behavior and personality changes, and executive function. I told you guys it was going to be lengthy. Next, we have the parietal lobes, which can really be divided into 2 functional regions. So, one involves sensation and perception, and the other deals with integrating sensory input and primarily the visual system. The first function integrates sensory information to form a single perception. The second function constructs a spatial coordinate system to represent the world around us. That's why when we see patients who have parietal lobe strokes, they have issues with perception and spatial awareness and body image. So when a patient has a right parietal lobe stroke, they'll have contralateral neglect, constructional apraxia, and anosognosia versus a left parietal stroke, your patients will have right left confusion, agraphia, acalcula, possible aphasia, and agnosia. If I pronounce any of the A words wrong, I apologize. But yeah, you'll see that there is a lot of like inability to write, difficulty with math, aphasia, you know, not being able to know, getting confused with left versus right, and body neglect, like left neglect. Okay, the correct answer is C. All of the following fall under the Gerstmann syndrome except anosognosia. So let's go over what each of these A words mean. So A is agnosia. And agnosia is the inability to recognize incoming information despite intact sensory capability. So the inability to perceive objects normally. Then we have agraphia, impairments with writing by hand. And then we have anosognosia is denial or even lack of awareness of one's paresis. So when they have left-sided weakness, they're either in denial that they're weak on that side or they lack the awareness that they are weak on that side and unable to um, function like they once did. Then we have D, a calcula, that's impairments with math. Okay, the correct answer is D. A patient appears to have difficulty expressing themselves verbally and right-sided weakness. Where in the brain has this patient most likely had a stroke? So there's some key points here that we could use to narrow down um, our answer choices. So first off, difficulty expressing themselves verbally. So that would be expressive aphasia, aka Broca's aphasia. And Broca's area is found in the frontal lobes. So you can technically mark out B and C. Um, the left temporal lobe is actually where you would find Wernicke's area, so Wernicke's aphasia. So that's when they are able to speak well, but don't they're not understanding what you're saying, so they'll have like good fluent speech but it won't make sense. But that's going to be in the next video. I had to break this up because it was getting too long, but you can mark out B and C simply because expressive aphasia is found in the frontal lobe. And then you're having right-sided weakness, so we discussed how weakness is the opposite of where the stroke occurred. So if you're having right-sided weakness, it happened in the left side of the brain. Thank you for joining us on Journey to 600. Please like, subscribe, and turn on our notifications. There will be a part 2 where we will go over the temporal lobe, the occipital lobe, and the cerebellum. So stay tuned for the next video, part 2, on strokes based on brain lobes. Thanks.